The head of Ontario's Hospital Association says Hamilton and the surrounding areas has now become the epicenter of Omicron in the province. Matt Ingram has more.
Still packed with patients, St. Joe's occupancy sits at 95% today.
We're still seeing unprecedented numbers. They're just slightly better than before.
St. Joe's infectious disease doctor Zane Chagla says there are fewer COVID-19 admissions than a few weeks ago, but the demand for critical care remains similar. The intensive care unit is full at 100% occupancy, still feeling the impact of Omicron.
Things are still very, very tight. Critical care services are probably going to be pressured for some time. These patients are staying longer, more patients that are intubated.
We haven't yet started seeing much of a relief or reprieve yet.
Hamilton Health Sciences ICU physician Dr. Faizan Amin says HHS hospitals are not seeing the steep decline in hospitalizations that Ontario is experiencing overall. Right now, occupancy across HHS hospitals is above 110%, and at some hospitals, it's higher. Ontario Hospital Association President Anthony Dale says Hamilton and its surrounding area stands out.
Probably the most serious and acute of all the regions in the whole province.
Juravinski Hospital is particularly overcrowded, reporting an overall occupancy of 126%. Now, HHS says that the ideal maximum occupancy for a hospital like this one is between 85 and 90%. Just like at St. Joe's, HHS's intensive care unit is really feeling the pressure.
We've been operating at beyond 100% capacity for weeks now.
HHS says the demand for critical care has forced it to transfer a few patients out of region. Overall, 21 patients from Hamilton, Niagara, Haldimand, Brant, and Burlington have been transferred to hospitals in the GTA and London. The hospital says it's still too soon to resume paused services like cancer screening and diagnostic imaging, but planning is underway at HHS and at St. Joe's.
With the capacities that they are, it's difficult right now to kind of go back to pre-Omicron kind of hospital functioning at 100%.
And it still might take a lot longer. Ontario's COVID Science Advisory Table is warning hospitalizations could start going back up as Ontario reopens. Matt Ingram, CHCH News, Hamilton.